Hi, everybody. Today, in honor of celebrating Doctors' Day, Team ED is doing something hatke, where we are not talking to existing doctors, but we are trying to get perspective from the young doctors, young students who are going to be the doctors of tomorrow. We wanted to interact with them, understand what makes them at this day and age when things are far easier to get than they were, of course, at our times, and what makes them want to take and what makes them want to become doctors. Go through the arduous journey of like 8 years of education and specializations just so that they can become doctors. So we have with us Sukriti and Aishwariya. Hi, Sukriti and Aishwariya.
Hi, Sanjana. Thank you for inviting us.
Thank you. Thank you for agreeing to do this. So tell me a little about yourselves, both of you. How long have you been studying, doing your MBBS? What year are you in? And
Okay.
yeah, and why did you both decide to become a doctor?
Okay, so I'm Sukriti and I'm currently a third year medical student studying at Kasturba Medical College, Manipal. And I don't know, I got motivated to become a doctor since my school days only. There was no one in my family who was a doctor, but my grandmother and grandfather always wanted me to become a doctor. And there was one thing inside me also that I like to help others. So that was the thing that motivated me to take up this branch.
And did you think about कि कितनी पढ़ाई होगी, कितना मेहनत करना पड़ेगा?
No, not at all. I didn't think about it. I only thought that I have to do something for others.
So Aishwarya, tell me, how do you think by becoming a doctor you will be able to contribute?
So one thing which we all know is doctors save lives, but their importance goes far beyond that. Doctors also make a difference by helping patients if there's any injury or disability, so how to live with them, and also help in relieving pain of the patient, emotional, physical. And one other aspect in this field is we get to do a lot of surveys and research. And I'd like to give one example, like during COVID-19, when everybody was scared to step out of their room, then it was doctors who were fighting day and night to save lives. And because of the combined efforts of all the doctors all over the globe, so many researchers and everything, today we are here at this point that WHO has announced that COVID-19 is no longer a public health emergency. So that's how doctors contribute to the society. So I really want to do something like that as well.
What is it that you both want to specialize in, and how do you see yourselves contributing as doctors, as future doctors of the country? Challenges क्या देखते हो आप हमारी कंट्री में हैं जिनको आप एड्रेस करोगे और जिनको आप सॉल्व करने की कोशिश करोगे? Sukriti, can we get your perspective, and then maybe Aishwarya can join in?
Yeah, sure. So I think nowadays there's a changing trend in communicable, non-communicable, and emerging infectious diseases. So, but I think our government, I have a strong opinion that our healthcare system has come a long way, and a lot of initiatives and programs have already been planned and very well implemented by all the government bodies all over India. What I think is the major challenge today is not the lack of facility or awareness, but an ardent need to introduce a behavioral change model. That means that, for example, a lot of diseases are caused due to certain risk factors, like people who have tobacco or smoke. For that, government has launched one thing that is called 5A strategy to leave tobacco, cessation of tobacco. So that is based on the behavioral change model. That that focuses on ask, advise, assess, assist, and arrange. So it helps the patient to understand why is he doing this habit, and he has to change his attitude to prevent the disease from coming into place.
Lovely. And this is what I understand you're talking, this is applicable across India, or would you see, say, largely applicable for um, urban India or
So
urban villages?
So basically, this behavioral change is more of needed in both urban and rural, because nowadays everyone is educated about things. Yeah, a bit of education is lacking still in rural areas, but I think with the good implementation of the plans, action plans, the yojnas launched in India and also all over world by WHO and
Mm.
other organizations as well, I think the awareness part of it and application part of it is very well done. But what is lacking is we as ourselves implementing those. We as like as patients, they should agree that they should do this, they are ready for this change to happen, they want to see them healthy. So that is what is required now.
Thank you. Aishwarya, how do you see the different, what do you think is different between, okay, sorry. Aishwarya, what is the difference between researching doctors and practicing doctors? And which kind of doctor would you like to be?
So, practicing doctors are mostly whom we see in the hospitals managing patients and, mostly dealing with all that. But researching doctors are mostly involved in finding new treatment for new kinds of diseases. And if there's any other emerging type of surgery or anything, so they are not mostly involved with patients, they are mostly going in a theoretical way. And personally, I would like to become a practicing doctor because I would like to treat patients and interact with them rather than just, like studying stuff.
Hmm. And how do you think we can, as all of us, as civil society and people who are non-doctors, decrease the burden on public health? What is the responsibility we can take to decrease this burden?
So, as we learn in one of our subjects, community medicine, it's taught that there are several levels of prevention of a disease. Firstly, before the disease has happened, you can prevent it from happening, like in diabetes. You can avoid eating sweetened beverages and foods before, if there's a family history of diabetes, then other level is you can prevent the disease by early diagnosis and adequate treatment. And lastly, if the disease has already progressed in an advanced stage, we can prevent the complications. So, as advice which I'd like to give to general population is like eat healthy, eat nutritious food with a lot of dietary fibers rather than junk food, and get regular physical activity, avoid smoking, drinking, get enough sleep. And if there's any doubt, please see a doctor. Don't wait for the disease to progress at an advanced stage. Get it treated as early as possible.
Wow, that was comprehensive. Already speaking like a doctor, huh? So, Sukriti, tell me something. What is it about your journey on to becoming a doctor that you're loving the most?
I started enjoying more in second year because had our we started with our clinical postings, that is hospital visits. So we were rotated in all the departments of the hospital. So we had an experience in all the branches of medicine, like medicine,
Hmm,
surgery, ENT, OBG, and talking to the patient, communicating with them, and trying to diagnose their condition and helping them is
hmm.
such a satisfying thing to me personally. So that is the most interesting part about it. And seeing the smile on their face after we talk to them and seeing their trust on us, that motivates me a lot.
Beautiful. So, one last question to both of you. What completes you? Is just studying to become, educating yourself to become a doctor completes you, or is there more to Sukriti and Aishwarya than just becoming a doctor?
We both are very good friends. We like to spend time with each other. We like to go for walk. We would like to party also, and we like to have a good group study discussions. Apart from that, we have a lot of hobbies. Aishwarya is such a good dancer,
Really?
and
Hmm.
yeah,
And so is Sukriti, party dancer, party animal.
And
and
what are your
personally,
Yeah.
I
hobbies
like to.
outside? How else? If you get time, how do you spend it?
Personally, what I like to do is I like to involve myself in organizing stuff. So, like, I've been heading student research forum of our college. Also, I've been heading IGCLA of our college. There's a one club for Indo-German Convention of Ninda Association, as well as many other things. So, like, I like to play sports. I was a part of volleyball and football team, as well as throwball team. So, like, I like to take part in co-curricular activities along with my studies.
And Aishwarya, do you get the time to participate in different co-curricular activities? Or does
Yes.
education take a lot of your time, a major part of your time?
I think all these things are equally important to studies. The your friends, parties, not so much, but they are needed because you get exhausted because of all the exams, a very hectic schedule. I was also a part of the quiz club of our college where I headed the email and correspondence team. And I also like to sing and dance and parties.
Lovely. So we've got two budding talents who are not just doctors, but also party animals coming up in the future, right? So one last question. What are you both going to be specializing in?
Uh, I have not yet decided. With whichever posting I have in the hospital, I get in my interest in that posting only. For example, I'm having OBG, I like OBG. I'm having medicine, I like medicine. So every subject interests me a lot for now. So I have not yet decided regarding that.
Fair enough, because you're still going through the entire gamut of the complex uh, world of our body, right? And Aishwarya, have you been able to zero in on anything, or are you also enjoying the process and of learning?
Actually, I think that I have decided I want to become an orthopedic surgeon, and
Wow. Hmm.
it is because I really like that subject. And the first time I saw a patient, I was in that posting only. So I think I have some sort of attachment to orthopedics.
Great. So thank you so much, both of you, for your time. And it's been an absolute pleasure chatting with both of you. Thank you so much. And as I mentioned, with ED's work in public health and our level of interaction with doctors, we thought it would be a great idea to meet the doctors of tomorrow. Yeah. So thank you for your time. Thank
Thank
you.
you so much, Sanjana.
Thank
We
you,
would like to
Sanjana.
thank the team
Thank you.
also for calling us.
Mm.